Many owners of dogs with behavioural issues can be hesitant to consider medication, instead hoping training alone will help or that their dog will grow out of it. Unfortunately, for most dogs with anxiety disorders, and I have two so I know, it just gets worse, often impacting on their ability to join in family outings or simply coexist with their owners harmoniously. Training and behaviour modification on its own for dogs with high levels of anxiety is rarely successful, as the anxiety actually prevents the dog from taking in new information, including how to be calm. Anxiety disorders are caused in part by a problem with how the brain functions. Low levels of chemical messengers such as serotonin, noradrenaline and dopamine affect how messengers are transmitted and received, and therefore how a dog thinks and feels, leading to increased feelings of anxiousness and worry over seemingly small things. It is without a doubt a medical problem that can not only cause behavioural issues such as excessive barking, destructiveness, aggression, fear and separation anxiety, but it can also affect other organs such as the bowel and skin. In the same way that a person with diabetes requires insulin, dogs with anxiety disorders require medication to help their brains function correctly. Medications most frequently used to help dogs with anxiety include fluoxetine, commonly known as Prozac, and also clomipramine. These drugs increase the level of chemicals in the brain that are responsible for promoting feelings of calmness and well-being. In some cases, where certain triggers or situations that set off the anxiety, such as thunderstorms, strangers, other dogs, grooming or a trip to the vets, might cause them to become more anxious, short-acting medications that take between 30 to 90 minutes to work, such as clonidine and trazodone, are prescribed. Sometimes they'll be given in conjunction with fluoxetine for maximum impact, and together they can really help an anxious dog learn to trust the world around them and learn alternative responses with the right training so that they can cope when they're feeling unsure. So if you suspect your dog has an anxiety disorder, please do speak to your vet, or ideally a vet behaviouralist, in addition to an experienced trainer that uses positive reinforcement training. Positive training methods are vital for dogs with anxiety. You can also visit the Pooches at Play website for more information about anxiety and related behaviour modification training tips and advice.